I want to start by remembering our past convenings, starting with our launch in 2018. I'd been on the job for 2 or 3 weeks, and I actually had on this dress, and I was so impressed with what the leadership team was offering all of you. I was impressed with Mission Minded, the branding firm, and I was really impressed with our turnout and all of your enthusiasm and joy. I remember hearing a lot of amens. I remember seeing people stand up and say, yes, I can commit to that. So I think a lot of you were there, whether we were in Los Angeles or Oakland. And what stands out for me about that convening in 2018 is that we unveiled a relational brand that shifted our messaging from services and needs to community building. And the research that our branding firm had done with leaders, with many of you, with members through surveys, with stakeholders, really determined that community, friendship, and relationship aging together were the highest values of the movement. I think what they say in Ashby Village is, we came for the services, but we stayed for the community. And that relational brand was really prescient because when we fast forward through the pandemic, we see healthcare paying for relational work. We see tech companies getting into the space that we thought we owned. The next year, 2019, we met in Newport Beach, and that was a really joyous occasion because we were together in person. Barbara Sullivan came from the East Coast, the Village to Village Network director. And I think that picture, Barbara, on your annual report comes from that day. Big smiles all around. Maureen Sullivan from the Motion Picture Television Fund gave a talk on social isolation and loneliness. I invited her because at that time I was very intent on establishing a theoretical framework to underpin Village Movement California's work. I was very intent on linking what we do to the field that's exploring the antidote to social isolation and loneliness. Fast forward, COVID, it's what everyone's talking about. It's what everybody's funding. So today we're meeting virtually. This is our third virtual meeting, and I'm really happy that so many of you came, that so many of you are still in the room, and I truly envision next year an in-person gathering that has a hybrid option. So how are we doing? The 2022 survey earlier this year shows that together, all of us together, we had a net growth of 6% during the pandemic. I'd say that's pretty good. A lot of nonprofit organizations closed. We did see one village close. We saw one open, that's TJ Village. And we saw the emergence of 2 new villages in Sonoma Valley and in Kern Valley. So we have some new villages in the mix. We saw tremendous growth among some villages, among their members. Those were the larger villages with 300 or more people, volunteers and members. Some villages saw a steep decline in their membership. Most villages gained volunteers in year 1 of the pandemic. Remember that? Young people wanted to help older people. And then that waned in year 2. And I know that villages are still struggling to gain volunteers. I think that we will succeed. I see that all of you are working very, very hard, and many of you are tired. And this has been true of our California villages and our national movement for many years. So can we change this? I say we have to if we're going to be a sustainable movement. The status quo is too hard to keep up for 10, 20, 30 more years. So fortunately for us, the context that Susan and Kate described yesterday provide us opportunities to scale and sustain our movement in California. So I want to just underscore a couple things related to the context. So yesterday, Susan Damaris, the director of the California Department of Aging, shared the data that the growth of older adults is going to land us in 2023 with 1 in 4 people will be 60 or older. This population will exceed children 18 and under. And she says that the resources of the society need to move to shift to the older adults. So my question is, will villages be ready to utilize these resources? And it's our organization's job to get you and all of us ready. You know, Susan didn't talk about the caregiving crisis, but there is a huge caregiving crisis. And we are going to see a shortage of about 3 million caregivers in the near future. Even if you can pay for care, there aren't caregivers. So as caregiving organizations, villages are caregiving organizations. Donna Benton, one of the premier leaders of caregiving in our state, said to us last year that villages are a caregiving organization. How can we step up to shape the future of caregiving? The master plan for aging, Susan talked a lot about it. Lisa just talked about it. It's really our linchpin. It's really our foothold into sustainable funding. And what I know in terms of the context is that everyone is focused on implementing the master plan. Advocates, service providers, legislators, the administration, foundations, and business. And we have our own objective. So we have a seat at the table. And how did we get a seat at the table? Because our founders were very wise to build a coalition where we could pool our numbers and we could come together with a unified voice and make ourselves known. And that's why we're in the master plan for aging, and the effort of all of you to go to in-person meetings, to write into the web-based portal, to call the CDA and your legislature. We all together under the umbrella of this organization, we're co-creating, got ourselves into the master plan for aging. So Kate talked about adaptation yesterday, and she asked the question, are we, villages in our movement, relevant? And if so, how do we stay relevant in a changing and challenged world? And I would say the language of the master plan objective around villages holds the answer. What that objective says is that we are to promote and adapt our model of volunteerism and services to reflect and take advantage of the strengths of California's diverse communities. That's why we have a Diversity, Equity, and Inclusion Training Institute. That's why I'm pounding the pavement across the state, looking for potential partners. I'm working with a group in Stockton that primarily works with communities of color. We must do this for our movement to become sustainable, relevant, and then sustainable. A point of information that I want to make sure you take away today. Kate also talked about the missing middle. And the missing middle is a really important concept and population. And it's one that we used during our conversations about the budget request with legislators and legislative staff and advocates. So in 2019, a study came out, and it's called The Forgotten Middle. And many middle income seniors will have insufficient resources for housing and healthcare. That brought attention to this truth. Another source of data is the Elder Economic Index, which comes out annually, and it shows how older adults are faring. And you better believe in California, with housing prices and now with inflation, they're not doing well. This problem is also called the eligibility gap. Our villagers, who are part of the 3.4 million middle and moderate income Californians, they, for the most part, receive Medicare. They have Social Security, and many of them have a pension or some other kind of investments, and they make too much money to qualify for Medi-Cal. Medi-Cal is the gate. Once the gate for Medi-Cal is opened, you, as an older adult, have access to many, many services. Are there enough services? No. Do we continue to advocate for more services for low-income older adults? Yes, but we also have this challenge of the middle and moderate income older adult, the missing middle, the forgotten middle, our people. And what I've learned is that there is tremendous concern among the state advocates and the players about this group. We don't want to destabilize middle income folks who aren't yet qualifying for Medi-Cal. We need to do everything we can to help them save their money for that time when they might need to go into assisted living, they might need to hire a caregiver, or they might need to go on Medi-Cal. The state is looking at offering a long-term care insurance benefit for this population. It is not going to help us, those of us who are in our 60s and 70s now. It will help our children and their grandchildren. But people are really looking at our middle income older adult population, and we can claim our population. There's nothing to be worried about or concerned about in claiming that, yeah, we do, for the most people, serve the moderate and middle income. Now, 23% of our villages say that they're offering subsidized membership, and I really want to give you a shout out for that, because we are concerned about older adults of different income levels, and we are trying to accommodate them. So just remember the missing middle, and I can be sending out more information to make a case. So I'm now going to move to the Village Movement California priorities. And I'm a Warriors fan during the playoff season. Like many of you, I spent dozens of hours watching basketball and reading about the Warriors, and I follow them on Instagram, and I listen to Draymond Green's podcast. And I noticed something that Stephen Curry repeatedly said after the final championship game. We maintain our purpose. He said that over and over again. We maintain our purpose. We maintain our purpose. It's been a journey. It's been hard. We maintain our purpose. And in a nutshell, Village Movement California's purpose is growth, impact, and sustainability of the village movement in California. They're interrelated. Growth will deepen impact as we reach more older adults and their families and their caregivers. Impact will fuel sustainability as we gain funding from the payers who are concerned about social isolation and loneliness, and who see villages as part of the caregiving ecosystem. Growth drives sustainability. Growth, growth, growth. Funders want to see that we are reaching lots of people. Village Movement California was formed to kind of bring all these numbers together under one umbrella. Not a village here with 100, a village here with 400, a village here with 75. All those villages are doing incredible work. But a movement reaching 10,000 volunteers, members, families, and caregivers. So we have to grow, all of us, in size, and we also have to grow the number of villages throughout California if we want to achieve sustainability, which is a word I hear a lot. So Village Movement California's two initiatives related to growth are the Training Institute, with which you heard about earlier. We have to reach more of the population that doesn't show up in our villages. When we look at Medicare recipients, right now they're primarily white. Very soon they will be primarily people of color, with Asian Americans, Latinos, and African Americans being our predominant populations. We are working with an African American focused organization, Sisters Aging with Grace and Elegance, and their work around Sankofa stories earlier this year was a partnership between Village Movement California and Sisters, and we're going to continue that partnership, and we need to have more. Another priority for Village Movement California, the growth strategy, is our village incubator. And we're forming a village, what we're calling a village incubator. Maybe we'll have a name contest to get a better name. But to seed new villages, to support new and existing villages. And we're looking at a web-based curriculum, a learning community, coaching, and workshops. One of our partners with the incubator is the Change Lab. The Change Lab is a design institute of the UC Berkeley School of Public Health. And we have a student with us today, Malika Jalili, who is assigned to the incubator project. And she and her colleague are going to be specifically focused on an equity lens for our curriculum. We have to have an equity lens. We have to look at what does this mean for non-white communities, LGBTQ communities. And she's also going to be looking at some tools around asset mapping and some other ways to do community building that keeps the diversity, equity, and inclusion in mind. I'm thrilled to announce that the Pasern Family Foundation has awarded Village Movement California a $150,000 grant to fund the director of the Village Incubator, and also to fund a communications and administration manager. So we'll be expanding our staff this year, and with that, our capacity, and with our ability to better serve you. And the Pasern Family Foundation grant is a part of their new social enterprise fund. And as part of that program, their business consultant and their executive director, who have joined us over the past 2 days, Ken Golden and Victor Nelson, will be working with us on a number of issues related to growth. So very, very, very exciting news, and very timely with the timing of the conference. So I want to talk a little bit about investment, because investment is key to sustainability. And who are the biggest payers? You've heard me use that word payer. The two biggest payers are government and healthcare. And we have to succeed in getting government and healthcare money. I'm glad to hear that several villages are receiving local city money. I know that Conejo Valley Village received some of the recovery funds. I think that La Marinda Village is going to be contracting with Lafayette, the city of Lafayette, to provide senior services. We need to work government, and we just wrapped up that work on the budget request. It was $3 million. It was to fund the fulfillment of our village objective with the master plan for aging. A third of that money was targeted to 40 villages. So we set aside money for most of you. And then $2 million was for Village Movement California infrastructure. We need to go back to the drawing room and figure out what is it that we want to ask for. What is the baseline funding that every village needs to open with every year, every fiscal year of the state? So we need to do this again. You heard Lisa, we're going to do this together. It takes all of us, and it matters to all of us. So we need to step out at the state level and also locally at the local level to interact with legislators, policymakers, and other people in the aging services continuum. Healthcare investment. So 3 years ago, I got up at that Newport Beach that Newport Beach event, and I told you that we would apply for Medicare coverage within a year. Well, that was really, really bold, and we haven't done that. So I'm being accountable to you, said we were going to do something. We didn't do it, but we did secure money to create a blueprint for Medicare coverage. And since that blueprint was developed, the pandemic has elevated social isolation and social connection as priority areas of investment. And that's what villages do. And the Center for Medicare and Medi-Cal is now requiring Medicare Advantage plans to contract with CBOs. We need to get into the fray. I'm going to be meeting with the California Association of Area Agencies in Aging director in 2 weeks to talk about how we might collaborate with them to secure Medicare Advantage coverage. Our consultants recommended that we put social connection at the center of a service plan that we would offer to Medicare Advantage, and that we partner with a technology company. So those are things we need to be working on this year. So speaking of technology, what platform are we going to use? Currently, villages use a range of platforms. Run My Village, I hear they were just sold. And maybe later Barbara offline can tell us what that might mean to villages across the country. Some are using Helpful Village. Some are using Salesforce, Assisted Rides, and Monami. Village Movement California has been neutral about platforms to date, but that is beginning to change. We are really interested in the Monami platform. It's an operating system in addition to being a data collection tool. And we've been talking to them about offering a price point to villages that could be covered by a grant. And we're looking for 5 villages to step forward to have a conversation with Monami about creating a pilot program to test out this platform. Next Village, San Francisco is using it. San Francisco Village is using it. It has some interesting features. So I'm going to pin that, and I'll be getting back to you around this opportunity. You know, there's another question about what data are we going to collect, and you all are doing a great job of collecting data around volunteerism, around rides, around some of the services that you provide. I want to find out what the payers want. What data does government want? What data does healthcare want? And how can that data be interoperable with that system? There is an effort within the national movement called the Taxonomy Project, and that's coming out of Capitol Hill Village and some of the other DC villages. And other villages across the country are starting to get involved. I have chosen not to invest in the Taxonomy Project at this point. The reason being is I don't want to advise you to collect data that may or may not be relevant to our funders. So I want to be clear about that because I know there's a discussion going on. I know that some of the data is being collected across the country. I think that there's been a data set for California. I think it's Village Movement California's role to figure out what is the data we want to collect, and then to aggregate that, to work with the platforms to then aggregate the data. So this is an invitation. If you're interested in that conversation, please let us know. We do have a data and evaluation team. We are working with the Change Lab. We are in conversation with people working on the taxonomy. We want to make sure that any data collection that we ask for is really worth your time. The last priority I'll share is communications, and Village Movement California, through a grant from the Root Foundation, has hired a communications consultant, Lightbox Collective, to create a communications plan that will focus on stakeholders. like AAA, like the California, the caregiver resource centers, like the Alzheimer's Association. We really believe that moving forward, villages need to be even more networked with the regional and with the state aging services continuum. It's a collective journey we're on with those stakeholders. So we want to be able to better communicate what we do with them. It's what Lisa said. If legislators don't know what we do, they're not going to fund us. So we're working on refreshing our communications plan to focus on our stakeholders. We are incorporating social media, and we will be sharing all of this with you. So I'm winding down. What are the takeaways? Growth, impact, and sustainability all feed each other. We are all in this together. Large villages, small villages, rural villages, urban, Southern California, Northern California. We all need each other to succeed and to grow. So, what's the call to action? Lisa has given one already. We need to meet with our legislators, and we're going to help you with that. So stay tuned. The Diversity, Equity, and Inclusion Training Institute. Talk about that opportunity. Think about who you want to go, apply. And as Yvette said, if we have more than 10 villages who can meet that requirement of the 4 meetings, then we'll open up another cohort. I want to take 5 villages to Monami to see how that works and to get you a discounted price. Read the newsletter. It comes out at around the 15th of the month. It's the best and most comprehensive view of everything we're doing. I tee up everything there. When people were shocked about the budget request, I had been teeing that up for quite a while. Read the newsletter. If you can't read it when it comes into your mailbox, go to the e-news archive and take a look at it. And finally, get involved in our coalition. As I said, we have teams working on program, data, communication. We can have more teams based on your interests and needs. If we want to get Braver Angels involved, we can do that through the Village Movement California platform. But you need to lead it. I want to give Katie Brandon of Pasadena Village a shout out. She's taken advantage of our platform by getting together a group of executive directors who meet every other month. I welcome you taking initiative to lead statewide work through the Village Movement California platform. The board, we have a board. It's an elected board. If you want to be on the board, let me know. Some of you have. Like many nonprofit organizations, we have a nominating committee that makes recommendations to the board based on who I'm hearing about, based on leadership that's emerging from our teams. The nominating committee interviews a bunch of people and then makes a recommendation to the board, who then votes for the next slate of candidates. We do that in Q3. And we'll be doing that again. So if the board is something you're interested in, let us know. So with that, I'm gonna wind down. I see a really important piece in the chat, which is that the boards of supervisors are taking public comment as they begin to develop their budgets for next year. So if you're thinking about county money, now's the time to go to your county board of supervisors. You can even go during the public comment period and just talk to them about what they're doing and ask them to consider funding your village. And we have a slide that we can send you about that. Carmen wrote about something very important, the Medi-Cal asset limit. Now, this is something that our moderate and middle income older adults are going to benefit from. California is going to eliminate the medical asset benefit starting next year. Right now, it's been raised to about 130,000. That means that village members who own their homes, but who have a low income, and we know that we have those members, they're food insecure, they're wondering about how they're going to pay for their medication. They will become eligible for Medi-Cal even though they own their own home. Because the last thing that California wants to do is put older people out of their homes in order to qualify for Medicare. So that's both a benefit for our members, and it's an example of how home owning older adults are a concern of the state. So I'm going to, Barbara Sullivan, Run My Village will not be changing anything in their operating program or software. They are looking to expand their existing software, and the merger with LumaWare will enable them to do that. So that's fantastic.